Good evening. This is Dr. Vivek Anand. Yeah, this is Dr. Vivek Anand. I am a consultant radiation oncologist at Hinduja Hospital, practicing since 12 years here. I'll be giving an update on prostate cancer, how to diagnose, what are the risk factors, what to do if we are diagnosed with a prostate cancer, and what are the treatment options we have in various stages. So first of all, we have to know why we have to think about prostate cancer. Over the years, the incidence of prostate cancer has been on the rise. Though Asian population have a lesser frequency or incidence, but we have seen in past at least 5 years there is a increase in incidence. So we have to be aware of this. So hence I say I request everybody, any male person should wake up to this and consider themselves that they are at risk of having this prostate cancer. Many people think that it might not happen to them because they have been quite healthy about their diet, their practices, and so on. But it's not so. If it has to happen, it can happen to anyone. So let's be aware of this. What are the facts? We should know that every man over 40 should know that prostate cancer can be caused. Though everybody has a sense that prostate cancer is not so malignant or malicious, but still, if it is left unchecked, I think it can cause some major disconcerns in the life. Now, what is prostate gland? Prostate gland is a gland which is situated in front of just below the urinary bladder and in front of the rectum, which is the size of a walnut, maybe around 3 into 3 into 3 centimeters, which is about 30 milligrams in volume, and it it functions are mainly to secrete semen during the intercourse, which is a thick liquid, and that is the only function this prostate gland has. And to some extent, it produces this male hormones. And as I said, it is below the bladder and in front of the rectum, which is the stool passing area, and the urethra from the bladder, which is the water pipe where we pass urine. It traverses through the prostate. So two lobes on either side of the urethra is the prostate gland. Now, what does prostate cancer mean? How much do we know about this? So, if we ask 10 people or 10 men, definitely only one or two will answer about this. So, today I'll take you through what is cancer and what causes this cancer, especially in prostate cancer. Cancer is a cellular disease and it is disordered or uncontrolled cell growth, and when it log linear form, like if two cells can become 4, 4 to 8, and 8 becomes 16. So if the tumor has to be felt or seen, it has to be at least about 10 million cells to cause a 1 centimeter growth. If the tumor is within the gland, the cancer is said to be localized and curable. If the cancer escapes the gland, that is, breaks through the capsule and goes into the adjacent structures like seminal vesicles or bladder, then it is less likely to be cured. Or if it goes into the bone, definitely it's not curable, we can only control it. I will be dealing with it in detail further. Now we know that if the tumor is within the gland, that is well within the capsule, then it is localized. And if it goes to the adjacent lymph nodes, which are the pelvic lymph node, which are at high risk if the tumor is growing for some time, then it is loco-regional spread. If it has gone to the other organs or bone, then it is systemic spread. Now, in prostate cancer, like other cancers, if it goes into the lymph nodes also, then it is systemic spread. But if it is limited to the gland, then there is a very good chance that we can cure it. What are the symptoms of cancer? In many of the cases, over about 60 to 65%, that you might not have any symptoms at all, but major symptoms which you can expect or anticipate is urinary frequency, mainly at night. That is because where we are free, we feel that there is an urge to pass urine. There may be a initial symptom, or a slow or a weak urinary flow. This will be caused because of the pressure over the urethra or water pipe. A painful urination. Sometimes if the urine is blocked at some point along the water pipe, then there might be pain. Blood in urine or semen when the prostate cancer cells have grown into the urethra or the bladder, then it can cause blood in urine. Impotency. If the cancer is again spread outside the capsule and infiltrating into the surrounding neurovascular bundle or the nerves and blood vessels, then it can cause impotency. Lower back or thigh pain or any other bone pain is definitely indicative of metastasis to skeletal or any bone. This has to be diagnosed appropriately. Now, how significant is this prostate cancer in the world? First, I'll be talking of the US, which is a significant concern in western part of the world, and then I'll give you some highlights about India. In USA, about approximately 230,000, that is 23 lakh men will be diagnosed with prostate cancer every year. This is one male is diagnosed every 3 minutes, and every 18 death. In Texas alone, an estimated 14,000 cases, new cases, have been reported in 2008, which shows us the volume of prostate cancer. Now, coming to the incidence, about 6% of all cancers in males, and 3,16,000 new cases diagnosed. For 40,000 deaths, only second to lung cancer, and chance of developing cancer in one man's lifetime is about 1 in 6. That means 1 out of every 6 men can have prostate cancer, which is almost 15% of all entire population. Coming to India, which is 5th commonest cancer in men, still we have the oral cancer, lung cancer, and other cancers leading before them, but it comes 5th in order, and 4th highest mortality in men. That means this cancer takes the 4th in descending order when it comes to deaths due to cancer. The incidence is approximately 4.8 per 100,000 population per year in Chennai, south of India, and 8.1 per 100,000 in Mumbai. These are all gathered by population-based cancer registries, and which may be not as accurate as other registries across in the world, but we expect around 18,000 new cases every year to be diagnosed, and it was showed in 2009. So almost there is a 1% increase every year in the incidence of prostate cancer. Now, who are these people who are at risk? The studies have shown that it's twice as common in African American men than Caucasians, and African Americans are more than twice as likely to die because of prostate cancer than any other breed. The other risk factors are age. The incidence of prostate cancer increases with age, but not least to say that 25% of the diagnosis is made under age 65. There's a significant family history of prostate cancer. That means if you have a first degree relative like father or paternal uncle who's suffering from prostate cancer, then you might be having a 2 or 3 fold increase in risk of prostate cancer. Diet, again, if you are consuming more of red meat or saturated fats, then the incidence is supposed to be double as in people who do not consume them. I'll be dealing with the diet a little more in detail. As a first thing I said about age, as in age increases, the incidence increases. So this is an example from the SEER incidence. SEER is survey. It's a epidemiological study from the US. So in these age group of 45 to 49, we have an incidence of 23 per 100,000. Whereas if you consider 65 plus men, you have more than 100 per 100,000 per 100,000. When you consider race, African Americans are the highest incidence, which is about 230.3 and per 100,000 again, and 55 men among these people will die. And if you consider Asians, 91.3, which is quite high, but our registries have not shown this kind of incidence. But I would say our registries are not so solid as to confirm this studies. This is from the Asians living in America. So there is a difference in what we are getting the cancer registry information from West and cancer registry information from India. There's a significant family history. There's 2.4 times increased risk for men with a first degree relative, as I said, either father or brother or paternal uncle. If they are suffering, there is a increase 2.5 times more that we will be suffering from prostate cancer. And the other risk factors, as I said, eating red meat increases the incidence of prostate cancer about 2.5 times. Dairy products which are rich in saturated fats, it is a significant risk factor. Vegetable oil is rich in alpha linoleic acid, and byproducts of all these fats promote growth and series of prostate cancer. Even chicken with skin is supposed to cause increased risk. A balanced diet in fruits and vegetable is expected to give us a better control over the incidence of prostate cancer, and so does low intake of red meat, processed and fried foods, and definitely to control our red meat servings per day, that is at least ounces, it should be less than that. That is what the studies have shown. And eating food with lycopene, which are high in tomatoes, watermelon, red grape, have shown that there is a decreased incidence if we consume them. Now, prevention, there is quite a few studies which have shown that selenium supplements in the organic form grown in yeast, at least around 200 micrograms, will reduce or prevent to some extent on the incidence of prostate cancer. And in randomized studies, these have been proven. And natural vitamin E, about 50 international units, is shown that to reduce the prostate cancer by 40%. Now, after knowing the important risk factors which can cause prostate cancer, I have highlighted these risk factors so as to, these are contributing risk factors. These are not something that it will happen uh, if you eat red meat or if you are a sibling of a person who is suffering from prostate cancer. but there are increased risk factors. So, how to avoid an advanced stage diagnosis? The simplest answer is early detection. But who are uh, at risk? We'll have to go through in detail. And how do we do this? Of course, you must have heard about PSA or blood test, which prostatic specific antigen, or digital rectal examination, which is just a clinical examination, which is done at bedside. Now, as I mentioned before, there may be no warning symptoms. There may be no warning symptoms caused by other conditions. These symptoms cannot be felt or experienced so as to you can go to a doctor and tell them that these are the symptoms and I have to be tested. So this can be got without any symptom. Prostate specific antigen is a blood test. A lot of work or studies have been undertaken to uh, judge when to do this test. It's a simple blood test. It is supposed to be specific to prostate, but it is not only to prostate. It can be raised during infections, it can be raised after a digital rectal examination, it can be raised due to smoking, it can be raised during if any hormonal injections or any other tablets are taken. And other test is a simple digital rectal examination, which is a physical exam which is done during at the bedside, which has to be done to feel the prostate lobes and see if there are any abnormal elevations or irregularity in the prostate lobes. The other things we should know about PSA test is that it is a simple blood test. Anytime 5 ml blood is sufficient, which will be drawn from any vein, and it has to be tested repeatedly if you are not having an abnormal PSA. And medical faculty or fraternity has divided usefulness of the single PSA. So whether to test all the men who are not at risk so as to detect prostate cancer, that is called screening, so which is not confirmed as yet, because in the West, in USA, it is not shown that it is helpful, but in Europe, studies have shown that it is quite helpful to detect early prostate cancers. So this, as I said earlier, it is not prostate cancer specific, but this antigen is prostate specific by and large. Now, why do I have to DRE? DRE, as I said, it is digital rectal examination. The doctor examines you by feeling through the prostate gland by inserting a finger in the rectum, and it improves the value of PSA testing. It is complementary to PSA, early disease detection. That is, if both DRE and PSA are suggesting that there is something towards cancer, then it is more important than only one test. Now, when do I have to start getting tested? In quite a few studies have shown that it should start as early as 40 years. But I would suggest if you are an African American man, then I think 40 years is the age to start with digital rectal examination. But Indians or Asians, 50 years is a good time to start. And if you have first degree relative who is suffering from prostate cancer, then I think it is ideal to start around 45 years. And these are all American Society guidelines, uh, but we do not have any guidelines from the Indian Cancer Society. What if the doctor does not offer PSA and DRE? I would say that any doctor, if he does not offer PSA, that doesn't mean that he's wrong, or if he offers, Does that mean it is right? No, it is not yet a standard across the world. So some countries have adopted that it is worthwhile uh, having a PSA test done every 2 to 4 years, but it is not so in Indian continent. And if a person wants, or if the patient or a person who is suffering from if he wants to get checked for PSA, then it can be done. But before anybody is offering you to do a PSA, they should also talk to you about what are the pros and cons about this PSA testing, and what if it comes positive. And if these things are explained to you, and then this test can be insisted upon. Now let's take some responsibility. As most of the men are not so keen on having a perfect health, I think doing a PSA once in 4 years is not too cumbersome, considering the incidence which is on the rise from the past 10 to 15 years. So if the PSA is done, and the normal range is usually 0 to 4 nanograms per ml, and this is just a guideline, it may vary from lab to lab. So if there is anything above 4, but mind you, there are about 20% cancers which are found which are less, PSA having less than 4, which, so some labs or some countries have decided that 2.5 nanograms per ml is the least you can have. Anything above that, they say it is abnormal. Knowing our PSA number lets us help track our own health, and we should not just accept PSA is fine from any doctor without getting a copy of the real number, just to be sure. And what if the PSA is high? One of the things we have to rule out is infection, that is local prostatitis, which is common, and suitable antibiotics are to be prescribed to rule out prostatitis or any urine infection, which is common across the population in any man. And one of the important things which will suggest that it is towards prostate cancer is that free PSA ratio test. There is some PSA which is bound to some proteins, and there is some PSA which is free in the serum. So if the fraction of free PSA ratio is about 15% or less, it indicates a high probability of prostate cancer, along with the rectum, which is detected by the digital rectal exam, and ultrasound and biopsy examination may be ordered if one of these tests are positive. Now, when is this prostate biopsy indicated, or why is this indicated? As I said, if there is an abnormal PSA that is more than 4 nanograms per ml, or a digital rectal examination which is nodular, or prostate is felt, there is some nodularity in prostate, then a diagnosis of cancer is only be made for sure by biopsy. Now, what is a biopsy? Biopsy is a test which is done to remove a part of the prostate. In prostate cancer alone, it's only done blindly, and it is done under as a routine examination without any anesthesia. If the PSA is more than 4 milligrams per ml, PSA level significantly increases from one test to another, and if the DRE is abnormal. So how is a biopsy performed? Under ultrasound guidance, a needle is attached to the ultrasound probe, which is passed per rectally, and this needle is passed in through the rectal wall into the prostate, and a core tissue, that means which is as small as about less than a quarter centimeter, or less than about 0.5 gram tissue is taken from multiple places. Usually, biopsy is taken from 12 to 16 parts of the prostate and sent for testing by histopathologist. Now, one if the when the biopsy is done, we have to expect a few things, side effects like sometimes blood in the stools for the next few days, blood in the semen or blood in urine, pain around the when you pass stool. So these are all associated. Some doctors suggest a course of antibiotics and analgesics or painkillers, but some may not. But if you are suffering from any of this, you can contact your doctor. And what if the case of diagnosis with a positive biopsy is got? Now, once you see that pathologist is specialized in reading a prostate cancer or a prostate sample, then be sure that it is prostate cancer. But definitely, you can take a second opinion from unbiased specialist, and the doctor will suggest you a few tests which have to be done to stage the disease, that is to find out if there are any cancer cells beyond the prostate gland by doing a CT scan of the pelvis. A CT scan, a CAT scan is of the pelvis is a simple X-ray which is done, which can see different tissues at a different intensity, and so that we can make out whether the pelvic lymph nodes or the stool passing area or any other spread is seen. And this is usually done if the PSA is higher than 20 nanograms per ml. An MRI of pelvis is also done to see if there is any extent out of the prostate capsule, so that usually it is done if somebody wants to operate on prostate gland. A bone scan is indicated or advised if the PSA is more than 20 nanograms per ml. That means the prostate cancer cells are more, so that is why the PSA is higher. So the higher the PSA, the poorer the prognosis is generally. But we'll have to rule out in multiple situations if it is raised by infection or any other reason. And once this is done, we'll have to stage the prostate cancer. And once we stage, this is useful so that in a few sentences we can communicate with the other doctors or other personnel that this cancer is spread this much, instead of explaining that it has gone to one lobe or it has gone to the opposite lobe or it has gone to the adjacent organs. Instead of that, we stage, we have definite for example, if it is stage 1, it is limited to one lobe and it is not coming out of the prostate capsule and it is not gone into the seminal vesicles. In stage 2, it can be that it has occupied both the lobes but it is not going into seminal vesicles, and in stage 3 that it has gone into seminal vesicles, which is adjacent organ, but not gone into the rectum or bladder. Stage 4 is gone into the rectum or bladder or lymph nodes. So this way we stage the disease. Once we stage the disease, we are sure that what treatment to advise or what management to do. Once we are through with this, then we can offer you a particular treatment. Now, having diagnosed a person with prostate cancer and stage the disease, then we have various treatment options like watchful waiting, surgery, radiation therapy, or hormonal therapy. Now, each condition is for different stages or different risk factors. Now, prostate cancer is generally depends on risk factors. We'll have to consider PSA, we'll have to consider the biopsy Gleason score, which shows us that Gleason score is nothing but the how different is it, the cell is different from the normal cells, and how these cells will multiply and what is the expected prognosis. That means how fast it will spread or how slow it will grow, we can have a fair idea about this. We should consider also something called as T stage, which I explained to you, that is tumor stage. Now, once we have got these four options, let's go a bit in detail. Surveillance or watchful waiting is something which has come off late from the past 6 to 8 years, which have shown that in very slow growing or very early stage of the disease, it may not be necessary to start an active treatment, that is surgery or radiation therapy or hormonal treatment. The doctor who's treating you might advise some necessary tests like MRI or bone scan, and then keep you under observation. But we need some tests to follow that every 6 months. That is a biopsy. A repeat biopsy may be considered to check whether it is progressing or it is static. So advantage of this watchful waiting is that treatment has an impact on lifestyle. That is, you will not be impotent or incontinent, but definitely there'll be a chance of growing beyond what is detected of today when you do it in the next time. So we'll have to keep in mind that we have to do some tests, not just forget that disease is a very early stage. I don't have to do. Now, this might be considered in mainly young patients, because the if it is, or very old patients because who cannot tolerate treatment. Now, moving on to the treatment option, we are well aware that surgery is an important and long, from since a long time surgery is going on, which is done under general or spinal anesthesia, where the entire prostate gland is removed either with the use of laparoscopy or a robo or open, which have shown that all are giving same results. But when we use some closed approaches like robo or laparoscopic, the hospital stay and the loss of blood is less, and surgeons have claimed that when using a robo, the chances of impotency following surgery is less. So advantage of removing the entire gland is that you remove the whole of cancer cells is removed, but it might not happen if it is spread outside the gland already even before surgery. So one of the disadvantages, that risk of post-operative complications, which I mentioned, impotency and urinary incontinence, is a significant deciding factor for this type of therapy. Now, coming on to the next therapy is radiation therapy. I will be giving you a overview just now, and I'll be continuing in my next webinar session, which may be after a week, about this. There are two kinds of therapy, which is external radiation therapy. That means radiation is delivered from a distance to the region of interest. In this case, it will be prostate and the seminal vesicles. And usually, if it is a radical treatment, it is done over a period of 3 to 8 weeks, and generally the it is well tolerated, and it commonly X-rays are used, or also called photons, which has the properties of traveling in straight lines, and it penetrates the tissue and deposits in maximum energy around the area which we have decided. Another form of radical radiation therapy is brachytherapy, where there are two types of brachytherapy: permanent or temporary brachytherapy. Both have shown that they have excellent control rates or cure rates. In permanent brachytherapy, it is small titanium or tiny, which is the size of a rice grain, titanium seeds which contains iodine 125 or palladium 103, which is encapsulated and inserted into the prostate under ultrasound guidance methodically. In case of temporary brachytherapy, first the needles are inserted, and once the needles are confirmed that it is in the right place, then a radiation source, which is usually iridium, is driven by remotely into these needles, and it will stay there for prescribed time, and it will deliver the radiation and come out back into machine. So this is called temporary brachytherapy. Whereas in permanent brachytherapy, it is once the seeds are dropped, these seeds remain in the body, which is not reactive to the tissues, and they keep on emitting radiation dose to the prostate cancer, prostate to the normal and the cancerous cell. The normal tissues do not have any function, so it does not have any major side effect. The major side effects being mainly the urinary bother. Because of these slow emitting radiation, they might have concerns of urinary bladder, frequency of urine, or burning sensation following the radiation, or occasionally they might have urgency to pass stools, or pain while passing stools, if at all, if there is radiation dose close to the rectum. In external beam therapy, that it is not an invasive procedure, but the uh, it is well tolerated. The only issue is that it takes a long duration, anywhere between 3 to 8 weeks, and there is a chance of increased risk of urgency or frequency of urination for a long period of time. I will be covering the entire risk of or the comps of brachytherapy, the indications of brachytherapy, and who should undergo brachytherapy, the general cost, and how is it different from surgery in my following webinar. Uh, and the next treatment option is, which many of the general surgeons or general physicians suggest, is hormonal therapy, which is not a definitive treatment if the prostate cancer is limited to the gland itself, but it can be an adjuvant. That is, if it can be tried before the primary therapy in case of radiation therapy, or following the primary therapy like surgery or um, radiation therapy. Now, there are two ways of blocking the hormones. These hormones are usually by secreted by the prostate, or even other sources like the pituitary and the adrenal glands, and mainly it is testosterone. It can be blocked medically by injections, that is, injecting luteinizing hormone or releasing hormone every 3 months to 6 months, or the testicles can be removed surgically. The advantage of this approach is that it can control the prostate cancer cells for a specific period of time, but the main disadvantage is that it can include hot flushes, impotency, loss of uh, desire, sexual desire, swelling and brittleness of bones. Now, with this, I will end my talk here, but we will discuss on brachytherapy of prostate in the following webinar. Thank you. Yeah, if you have any questions, I would be glad to answer them. Please go ahead with the questions. Usually bone marrow testing is not done for prostate cancer unless there is a widespread disease into the bones. But if a test is done from the bone marrow, it is almost certain that if it is positive, we will get 100% chance that if the right result. Yeah. And if it is done by an experienced doctor, when you remove the tissue, you will know that you've removed the bone marrow. And if it is a clot, you can make out that it is a clot. But by and large, if if you removed the sample, a proper sample, then getting the test right is 100%. A bone marrow test is performed by inserting at least is MRI a good test for testing cancer? Depends on which cancer it is. If it is prostate cancer, yes, nowadays lot of development or advances in MRI where a lesion by doing what we call as dynamic enhancement tests or newer functional imaging, we can detect cancer. but but it is very good in brain for sure, or if there is a bone involvement or so. Yes, if you are talking about prostate cancer, it can be as less as 50% or as high as 50%, because in prostate cancer it is always blind biopsies which are taken from different prostate cancer. So there are some recent reports that we have to detect by where the lesion is and hit the right area. So I would say it is as good as about, if there are lot of cancer cells, the uh, chances of getting a prostate cancer diagnosis is about 90%. But uh, do we have to double check? Yes, it is better to double check, but if it has come from a experienced or an renowned pathologist, I think we can go ahead with the uh, result. If the depends on the stage of the cancer, so there is no treatment which is 100%. As I said, if we consider for a early prostate cancer, let's say stage 1, and we offer either surgery or radiation gives results as high as 75% of the time. So we can be sure of treatment in most of the cases. How will I get to know I have prostate cancer? I think I narrated. I will go through it again for you. The first test is to undergo PSA. PSA is a simple blood test which can be done during any time of the day. We have to be careful in interpreting the PSA results. If the person is suffering from urine infection, or if the person is having other inflammatory conditions of the prostate, or if he is a smoker, then the results, or if he has undergone a digital rectal examination just uh, before the PSA, then there can be a variation or unexpected results. But PSA is quite, as of today, it is one of the important tests, and we have to do PSA. And if it is more than 4, there is a need for him to undergo digital rectal examination or a biopsy, or both. In digital rectal examination, we do what is called as examination of the prostate by inserting a finger into the prostate, into the rectum, and feel the prostate lobes. If there is any nodularity, there is a high chance that there may be malignancy in prostate. So PSA and abnormal digital rectal examination findings, and followed by a biopsy, that is taking a tissue from the prostate gland and sending it for histopathological testing, confirms that there is prostate cancer. Usually if my testicle starts paining, okay, after radiation, depends on there, as I said, there are two types of radiation: external beam radiation therapy or brachytherapy. Generally, during external beam radiation therapy, the first 2 weeks there will be no side effects. The starting of third week, person or the patient might experience increased frequency or urgency of passing urine more at night, or occasionally he might have pain while passing urine or burning sensation while passing urine. And over 5 fifth week, 6th week, 7th week, these symptoms might aggravate, and sometimes occasionally one or two patients in 100 we might have to give a break. But following completion of radiation therapy, it will settle down in 2 to 3 weeks time. And about brachytherapy, since it delivers more radiation in one sitting, we can expect for 2 to 3 weeks some urgency or burning sensation while passing urine, which will fade over the days. Uh, will it affect the sexual life? Radiation, the external beam radiation has shown that post radiation, approximately 60% of the patients will have impotency. Yes, it affects the sexual life. If there is a good chance of affecting the sexual life if it is already disease has spread to the adjacent neurovascular bundles. There are nerves and blood vessels just adjacent to the prostate gland, and if that is affected, definitely there will be affection of sexual life. And there is a 40% chance that he might not have any sexual defect. But in brachytherapy, there is a better chance of not affecting the sexual life, since the radiation is much more controlled and limited to the prostate gland. All the treatment and testing for prostate cancer done? Yes, testing and treatment is done in prostate cancer. In fact, in city of Bombay, we are the leading hospital in treatment of cancer. We have specialists, both surgeons, radiation oncologists, and other medical specialties, including pathology for this prostate cancer. Thank you.